I'm going to give a short talk about food intolerances in children. As you know, the incidence of food intolerances have increased over the last few years. Many parents are worried about these symptoms which happen in their child after eating various food items, and many times they're terrified to introduce new foods, fearing that the new symptoms would start, which could affect the child's health. So generally speaking, food intolerance means any untoward symptom you get after eating a particular food, which is seen only in some people, obviously. And these symptoms are mostly related to your gut or the bowels, causing symptoms like abdominal pain, tummy pains, feeling sick, loose stools, tummy cramps, bloating, which produce a lot of gas in the stomach or the intestine. And these are the main symptoms for food intolerance. But sometimes you can have symptoms in other parts of the body, like the skin, which cause skin rash, or in small children, it could cause generalized irritability, a feeling of unwell, tiredness, and headaches. These are the less common symptoms of food intolerances. So coming to the common food intolerances in children, the commonest one which most people know is lactose intolerance, which is basically an intolerance to manage the lactose in your diet. The lactose is called milk sugar, and as the name implies, it is present in all dairy products. So the basic problem is people with this lactose intolerance, they don't have a chemical, which is an enzyme in their gut, which digest the lactose, which is a sugar, which is the milk sugar. Because of that, they have symptoms like bloating, cramps, loose stools, and things like that. The other types of food intolerance, which are less common, the gluten intolerance, which is basically intolerance to gluten in food items like wheat, rye, and barley, mostly wheat. So again, this can cause unpleasant symptoms like tummy upset, feeling sick, loose stools after eating a gluten-rich food item. The other types of food intolerances are intolerance to food additives. Like, as you know, prepared food has a lot of added things like coloring agents, preservatives, and things like that. So, for example, things like MSG, which is monosodium glutamate, sulfite, these are all coloring agents and preservatives, and artificial sweeteners like aspartame. These all can cause intolerance in people. Some other food items which are naturally all right in most people, like a caffeine containing food, or some food items which has high salicylate or histamine, they can cause intolerance symptoms in certain people. So these are the common causes of food intolerances in children. So basically, the basic difference is food intolerance is a local irritation of your bowel or your gut after eating a particular food, maybe because your gut is not able to digest that food, or the food or some ingredients of the food you're eating is causing some irritation to the gut. And that is the basic reason for intolerance. Whereas allergy is an immunological response. It's related to the immune system of your body. As you know, the immune system is the defense of your body against external harmful harmful things like infections or other harmful chemicals. So the immune system gets involved in food allergy. The immune system thinks that the food which you are eating, which is all right in most people, is something harmful, and it mounts a defense reaction against this food, especially the protein in the food. And this causes a set of reactions which causes the body to make a lot of chemicals which produces all these symptoms of food allergy, like swelling of the face, rash, like hives, vomiting, all these things. So the basic difference is food allergy is not related to your immune system, but food intolerance is not related to your immune system, but food allergy is. And food intolerance symptoms is mostly related to the gut, your bowels. But food allergy can cause symptoms in various parts of the body. The other difference is food intolerance symptoms are usually delayed by a few hours or even up to a few days after eating the food, whereas food allergy is mostly very quick. Usually within a couple of hours of eating the food, you have these symptoms. And the symptoms of food intolerance are usually mild or moderate, not fatal or life-threatening, whereas the symptoms of food allergy can be life-threatening, where we may have seen recent news reports of fatal incidents with the food allergy. But having said that, food intolerance, even though it is usually not fatal or life-threatening, it can seriously affect the quality of your life because of chronic symptoms. And in food intolerance, many people are able to eat small amounts of that food, which causes the intolerance. So only when they eat that particular food in huge amounts, they have the symptoms coming up. Whereas in food allergy, even a tiny amount of that food can cause symptoms. So these are the main difference between food allergy and food intolerances. To answer that, it's not necessarily hereditary, but we have seen cases of food intolerances running in families, basically. So this could be due to a common genetic influence the family members have, or the common food they all eat in the same family. So there's no strict genetic pattern which you can see in food intolerance, but it could happen in families. The condition called lactose intolerance, which is in fact the commonest cause of food intolerance, can run in families, because if you have that genetic predisposition to have this lack of enzyme in your body which digests the lactose, then you can have it in families. So obviously, the symptoms of food intolerance are very non-specific, especially in a small child who can't communicate to you what's happening. As I said, the symptoms are mostly related to the gut or the bowels, like vomiting, aversion to food, a lot of gas in the tummy, diarrhea, crying all the time, maybe because of the tummy pain. So these are the common symptoms of food intolerance. And after a while, you might notice that these symptoms come on quite consistently after having a particular food, that too in high amounts. So the key for the diagnosis of food intolerance is by keeping a food diary for a reasonable period of time, for about 4 weeks, to keep a food diary where you document all the food that the child had a child is having on a day, and then you document the symptoms, if at all the child get any symptoms, and also document how long after eating the food the symptoms started. So by keeping this record, and referring back to the record, then you may be able to pinpoint a particular food item which is related to the symptoms of your child. So that is practically the only way to pinpoint a food which can cause food intolerance. Unfortunately, the test which we do for allergy, like food allergy test, is not going to help with the diagnosis of food intolerances. Having said that, there are some tests available to diagnose lactose intolerance, like the breath test, or even the fructose intolerance, which is intolerance to eating high amount of fruits. So these two things can be diagnosed by the breath test. But the main state of diagnosis is by keeping a food diary and noting the symptoms. So if you really suspect that your child has got a food intolerance to a particular food, if the suspicion is a good high amount of suspicion with a particular food, the next step forwards is to avoid that food in the child's diet for about 4 weeks and see whether the symptoms improve. So if the symptoms of intolerance are due to that particular food, for example, dairy or wheat or some sort of processed food, then avoidance of that food will definitely improve the symptoms. So if there is no improvement in the symptoms whatsoever, then you can assume that this food item is not related to the intolerance. So when you have a trial of avoiding food, you should always do one food at a time. Otherwise, it just confuses and muddles up things. So if one food is not related to the improvement of symptoms after about 4 weeks of avoidance, then you can try another food item which is high in the list, which you, according to the food diary which you have kept. So that's the way forwards. And if there is improvement in the symptoms, then the next step is you introduce this food back into the diet in small amounts. Because many children with food intolerances like lactose or gluten, they are able to eat small amount of that food without any symptoms. So only when they eat huge amounts of that food do the symptoms come back. So they may be able to tolerate small amount of food. So that is the reason for gradual reintroduction in small amounts and see whether the child is able to tolerate. And again, gluten, people should understand that gluten intolerance is different from celiac disease, which is a completely different entity, basically, which involves the immune system, the celiac disease, unlike gluten intolerances. I think that is a short description about food intolerances. Thank you.